You are listening to part 50 of our series, 7 Medicines, The Wise Woman Way with Susan Weed at Time Monk Radio. Hello, Susan, and welcome back to Time Monk Radio.
Hi, Gemini. I hope I didn't freak you out too much last week.
That was very interesting, and I thought it really on point about treating women differently than men as far as blood pressure goes. I had no idea, and that makes perfect sense.
Right. We're not just smaller men. We're really hormonally richer and hormonally different.
Yes.
So we really have to, as women, push a little more and not necessarily push our doctors to give us more drugs or better drugs, but push ourselves a little more.
Seemingly, yeah. We have to drive our own care and become very knowledgeable.
And to get up, if you do have a job in which you sit, to find ways to get up. One woman was complaining to me about her hyperactive bladder, and I said, you can bless your bladder because at least it makes you get up every hour or so and take a walk.
Yes, absolutely.
In fact, I've suggested that some women, pretend they have a hyperactive bladder and say, oh, I'm sorry, I have to go pee, and just go take a walk, take 5 minutes out of every hour. That's really all it takes. We're not talking about having to, get involved in some super spandex massive exercise program. We're not talking huge lifestyle changes here. So let's look a little more into the horror that is blood pressure drugs. And I really had no idea. I kind of thought of them as like, well, so many people take them. They must be fairly benign. They can't be having too terrible side effects. But then as I began to read that, for the vast majority of people, it's just not going to work to give them one blood pressure drug. You have to give them a different one. And that's why there's all these different ones. And then you have to start combining them. I'm like, oh, my goodness. All right, let's just briefly go over what they call the 4 major types of blood pressure drugs, the diuretic drugs. They're pretty inexpensive. They have a long track record. They reduce blood pressure really well. And there are physicians who say that's all you need is a diuretic. But remember, there are also physicians who say I would never, ever give a diuretic to anyone at all. They do increase urination, so you may get that hyperactive bladder there. They will worsen gout. They can cause problems with low blood pressure, and probably the biggest problem for men taking diuretics is they do cause erectile dysfunction. And, of course, you're not supposed to be taking those drugs for ED if you're taking blood pressure drugs. And yet the blood pressure drugs cause the ED. And then we have the ACE inhibitors. They've got a good safety profile. They're the only ones that are safe for any patient with diabetes or kidney disease. And basically what ACE inhibitors do is they prevent a hormone, angiotensin, from acting on the arteries. But remember that they cause a cough in 20% of patients, and they raise potassium to a really extraordinarily high level, and they seem not to work very well in African Americans. And then we have the ARBs, the angiotensin receptor blockers. They also have a very good safety profile, and they can be used by people with diabetes or kidney disease, and they basically act the same way that ACE inhibitors do and have pretty much the same problems, but they are far more expensive. And then calcium channel blockers. And I was quite interested that they say that any patient who has a migraine and high blood pressure or a history of migraines should consider taking the calcium channel blockers because they tend to reduce migraines, although they increase headaches in general. They're also recommended for anyone who has esophageal spasms, but they worsen gastroesophageal reflux, which is kind of the same thing. In GERD, the esophagus is too relaxed, and of course in a spasm, it's too constricted. So the calcium channel blockers, by blocking calcium channels, tend to make things blood vessels included, more relaxed. We can begin perhaps to have a little sense of why there are so many blood pressure lowering drugs and why so many people have to take another drug and another drug to deal with the side effects. You have heard me many times throughout our shows, and especially as we have gotten into talking about drugs, refer to a newsletter called Worst Pills, Best Pills News from Public Citizen. They're at www.worstpills.org. And an issue just a year ago headlined, Evidence Confirms Danger of Using Blood Pressure Drugs Together. Public Citizen, that's the group, has filed a petition with the Drug and Food Administration to place a black box warning on drugs used to treat high blood pressure when used together. ACE inhibitors, ARBs, and the drug aliskiren, when used individually, can be effective in treating high blood pressure. But if you take a drug from more than one of these categories in combination, not only will you get no added benefit over using one drug alone, there are dangers involved. ACE inhibitors and ARBs are among the top-selling medications, with 164 million ACE prescriptions written last year and 86 million ARB prescriptions written last year. Aliskiren had 2.4 million prescriptions, and so widely. It's estimated that about 1.5 million people were taking both an ACE inhibitor and an ARB in the U.S. The ACE inhibitors, the ARBs, and the aliskiren all act on a biological pathway that is central to the regulation of blood pressure and the body's saltwater balance, which is known as the renin-angiotensin-aldosterone system, RAAS. When used individually, these drugs can slow the progression of congestive heart failure and lower blood pressure. But used in combination, the side effects that any one of them cause are more than doubled. Dangerously high potassium levels, kidney failure, low blood pressure so low that the person feels fine, gets up, and crashes to the floor, breaking their head open. New studies are confirming these dangers. The most important was published in the British Medical Journal in 2013, and it was a rigorous review of 33 high-quality randomized clinical trials comparing the use of these ROS drugs with the combined use of ROS drugs with the use of one alone. There were about 68,000 trial subjects, and they found that combination therapy did not reduce the chance of dying, including the chance of dying from cardiovascular problems. In fact, it increased dangerously potassium levels by 55%, low blood pressure by 66%, and kidney failure by 41%. Over the past few years, 2 clinical trials on these drugs had to be stopped. 2 clinical trials on combining the drugs had to be stopped because the diabetic subjects in the study were having such bad effects from taking them. Although Public Citizen has requested a black box warning regarding combination therapy, the FDA has not done that. So you may be prescribed 2 different drugs by your doctor, or you may be prescribed only one pill from your doctor, because these drugs are combined in pill form. There are dozens of different blood pressure medications which are already combined, so you would not necessarily know that you're taking a combination therapy. If you do decide that you want to take a drug to deal with high blood pressure, and I hope that you don't, please talk to your prescribing physician and make sure that you are getting just one drug and not a combination drug. Worst Pills, Best Pills also had an article about alpha blockers and alpha blockers interacting with other drugs, not necessarily drugs taken for blood pressure. Alpha blockers include alfuzosin, doxazosin, tamsulosin, and terazosin. And those are Uraxatrol, Cardura, Flomax, and Hytrin. All alpha blockers can cause a sudden drop in blood pressure, especially at the beginning of therapy. And that is why Public Citizen advises anyone taking an alpha blocker to start with a low dose of the drug and to take precautions. I'm not exactly sure what they mean, like wearing a football helmet. Falling and hitting your head is a very real risk with these. Little is known about the effects of combining two alpha blockers together, and therefore it is not suggested that you do that. Alpha blockers interact with other drugs as well, partly because they are metabolized by certain enzymes that can be inhibited by other drugs. So, if you take Prozac or Paxil or Benadryl or Haldol, they are going to inhibit the pathway that is supposed to get rid of the alpha blocker from your body. And what that means is that you will have a dangerously high level of that drug in your blood for much longer than you should. Also, if alpha blockers are used with ulcer drugs like Tagamet, there is a 44% increase in the amount of alpha blocker in the blood. People often talk to me about, aren't I worried about herb-drug interactions? And the fact of the matter is, I am not very worried about herb-drug interactions. What I'm really worried about is drug-drug interactions. You remember that when we were looking into antibiotics, that I referred to a book called Drug Muggers by Susie Cohen, put out by Rodale Press. She talks about several of the medications that we've been talking about. For instance, she has a long, long list of beta blockers. And I'm not going to read that list to you. I am simply going to say, as she says, this class of drugs is enormous. There are so many types and subtypes of beta blockers that I couldn't list them all. There is a beta receptor on your cells, and beta blockers sit there like, and I quote her, like a Rottweiler to prevent chemicals from latching onto the cell. So by blocking that beta doorway, that receptor, the nerve impulses that would make your heart beat faster are literally blocked. When you get stressed, when you exercise, when you have great sex, you reduce adrenaline. And this makes your heart beat really strongly and makes your blood pressure rise, which is exactly what we want it to do. But beta blockers prevent that from happening. That means we don't get that benefit of those things. Now, certainly, for people who are terrified to do public speaking and their heart rate and their blood pressure go through the roof, a beta blocker is a really excellent choice. People who are having angina and don't respond to other drugs, a beta blocker can be quite excellent for them. However, be aware that you are going to have difficulty with potassium levels if you're taking beta blockers. You are going to have to really watch out about alcohol. In fact, beta blockers combined with alcohol can slow breathing and heart rate to the extent that the heart stops. If your healthcare provider has told you to take a beta blocker to lower your blood pressure and told you to drink a glass of red wine with dinner, make sure that you are taking a low dose of a beta blocker. Don't drink orange juice. Now, we all know about grapefruit juice, but you can't drink orange juice with beta blockers either, because orange juice, unlike the grapefruit juice, which makes more of it go into your blood, the orange juice actually reduces the amount of drug in your blood. In one study, they found that taking beta blockers with a protein-rich meal increased the bioavailability of the drug by 53%. So in one way, we could say, oh, wow, that's dangerous. But actually, I look at the glass as half full here, because if I'm going to take a drug, I want to take as little of that drug as possible. So we know that taking any heart drug, any blood pressure lowering drug, is best taken late at night just before bed. And now we know that we want to take that with a high protein snack, and that will increase the bioavailability of the beta blocker by 53%, so we can take a much lower dose. Be careful with salt substitutes, because most of them are potassium chloride. And also, it is not suggested to take anything with licorice if you are taking beta blockers, unless that's deglycerized licorice, because there can be some very low blood pressure incidents. All right, let's see what Susie Cohen in Drug Muggers has to say about potassium-sparing diuretics like spironolactone, triamterene, and amiloride. They, like all diuretics, make you pee more. And although most diuretics cause you to lose potassium, these cause you to retain potassium. They are often prescribed with other kinds of blood pressure medications. And what's important here is potassium. Potassium levels fall too low, you get a dangerous condition that can slow or stop your heart. In other words, if you take a diuretic that takes too much potassium out of your body, you wind up with a heart attack from lack of potassium. On the other hand, if you have too much potassium, it's not good either. So be careful about using salt substitutes if you're taking a potassium-sparing diuretic, because then again your potassium level could get way too high. They actually suggest that stinging nettle removes potassium from the body and works against this type of diuretic, but I have not found that to be true. I have been working with stinging nettle for more than 30 years, and I think the difference here is that she suggests a stinging nettle supplement, which is dried herb in a capsule, and I, of course, always use stinging nettle infusion, which is a water-based brew that you make yourself at home. I said it before, and I will continue to say it over and over again. There is no way to compare the effect of an herb brewed in water with an herb taken in a capsule. Herbs in capsules are the least effective, most expensive, and most dangerous way to take any kind of herb. They do talk about dandelion, and they say that dandelion is a potassium-sparing diuretic, And so you should avoid dandelion if you're taking a potassium-sparing diuretic. And to me, that's backwards. I would say, let's avoid potassium-sparing diuretics if we're going to be using nettle and dandelion, because obviously those are the better things to use, aren't they? Makes a lot of sense to me. All right, just a couple of more things here. I found this article quite useful. I really enjoyed this article by Mark Houston, M.D., an associate clinical professor of medicine at Vanderbilt University School. And he's the author of What Your Doctor May Not Tell You About Hypertension. So here's the myths and the facts. Myth number 1, your blood pressure taken in my office is the gold standard. Well, you probably already know that there's not a person doing it in the office anymore. It's an automated office blood pressure machine. And you know what? Those automated machines, they don't really give that good or accurate a reading. To really get an accurate blood pressure reading, you need to be resting in a seated position for at least 5 minutes with your arms supported on a table before the blood pressure reading is done. Never known any medical professional to give me that amount of time. And remember, there is white coat hypertension. That means some people just get higher blood pressure when they see a doctor. You can get an accurate blood pressure reading at home with a cuff-style monitor. They say don't use the ones on your wrist or your finger. You've got to get the one that fits over your upper arm. But I tell you what, the ones that fit over your upper arm are cumbersome, they're large, they're expensive. So what I usually suggest to people is get the cuff one. Okay, it's not as accurate, but you know what? It's not like you want a super accurate reading. What you want to do is take your blood pressure many, many times if you're working with your blood pressure. Take it after you drink a cup of coffee. Take it after you smoke a cigarette. Take it after you've had great sex. Take it after you've had an argument with somebody. Take it when you're feeling depressed. Take your blood pressure all those times when they tell you not to take your blood pressure and see what you're doing in your life that affects your blood pressure. I did this for 6 months. I took my blood pressure 4 or 5 times a day at all different times. And the thing that changed the most in my life from my doing that was that I saw that when I didn't get enough sleep, my blood pressure went up. And nothing could have convinced me to get in bed and snooze more than seeing how adversely it affected my blood pressure. Myth number 2. You can just check your blood pressure every now and then. Well, no, that's not what I just said, and that's not what Dr. Mark Houston is saying either. He's saying, think about 24-hour ambulatory blood pressure monitoring. It's done routinely in Europe, but it's somewhat of a novelty in the United States. However, studies are showing that it is indeed the most effective way to measure blood pressure. When you're getting ambulatory blood pressure monitoring, you wear something around your waist that controls a blood pressure cuff that measures the pressure inside your arm at the elbow crease. It takes a reading every 15 to 60 minutes over a 24-hour period and allows your doctor to see exactly what's happening. Dr. Houston says, have the test once if you're diagnosed with hypertension, and then repeat it to see how your treatment is working. Again, remember, we can use these diagnostic things to help us use alternative treatments. We don't have to restrict them to drug treatments. Myth number 3, take your blood pressure medicine anytime you want to. Blood pressure drops 10 to 20% during sleep, but about 25% of people who have high blood pressure do not experience this nighttime drop. Their blood pressure is elevated all night. So it's better to take your medication after 9 p.m. In fact, we find that taking any kind of blood pressure drug reduces cardiovascular events like heart attacks by 61% when we compare taking the same drugs in the morning. Myth number 4, sodium isn't such a big deal. Well, sodium is a big deal. Excessive salt causes vascular damage. The recommended daily limit for sodium is 1,500 milligrams for adults 50 and older. That is a huge amount of salt. And if you are eating home-cooked food, you can put as much salt as you want on your food, and you will get nowhere near that amount of food. Where you're going to get that salt is if you're eating out, if you're eating processed foods, and if you're eating canned foods. Although the nutritional value of canned vegetables is quite high and associated with longevity, the salt in canned things is way too much. And don't assume that sea salt is different. Salt is salt. Myth number 5, you have to take drugs if you have high blood pressure. There are a lot of ways to deal with your blood pressure. In fact, 62% of all patients who changed their diet were able to stop their use of blood pressure medications in a recent study. And we'll be talking about all of those ways next week when we get back together again. And myth number 6, food doesn't have anything to do with blood pressure. Food has a lot to do with blood pressure, and we are also going to be talking about those foods that can help us with our blood pressure. And you will smile to know that they are tasty foods. They are delicious foods. In fact, one of the foods that helps to reduce blood pressure is chocolate. So when we are talking about foods, we are not going to have to do terrible things. We're going to have a really good time with the things that can help us reduce our blood pressure. So that's the story on blood pressure drugs. And it's not a pretty picture. I was indeed rather astonished at how much problem there is when you go to a doctor and the doctor takes your blood pressure. It's such a simple and ordinary thing. We all think of it as, oh yeah, that's one of the things that happens. You go to the doctor, you're measured, how tall are you, you're weighed, how much do you weigh, and then your blood pressure is taken. I told us way back in the Second River story medicine that we go for diagnosis because we want a story. This is not a situation where we want a story. We're not going to have our blood pressure measured because there's some problem. We don't even know. Remember that blood pressure can be the silent killer. And yet exactly the same thing happens. When we engage in something that gives us a story, like the game of chutes and ladders, we suddenly find ourselves on a slide going full tilt boogie into the Sixth River, take drugs, or even the Seventh River. We have to do high-tech imaging on you. This is one of the reasons why I recommend that people check out their blood pressure themselves at home. Again, I understand that the cuff blood pressure monitor that you can get for really inexpensive price at a drugstore is not that accurate. But what we want to do is to see your blood pressure rising and falling. And so if you're using it just on yourself, it's accurate enough for you. Next week, we're going to get started looking at all of those yummy ways to lower our blood pressure. Strawberries dipped in chocolate, anyone? That's where we're going to start. And then we're going to go on to a cool drink of hibiscus tea, and perhaps we'll have some garlic bread with it. I'm going to be talking about 3 of my favorite herbs to lower blood pressure: motherwort, passion flower, and hawthorn. And I also want to remind listeners that we did do a series on Have a Healthy Heart, the Wise Woman Way, here for Time Monk, and that you can go back into the archives and find more detailed information about lowering blood pressure with healthy lifestyle. Thank you so much, Gemini. I so enjoy being here and having this opportunity to talk to people about herbal medicine, people's medicine, the medicine that grows right outside your door.
Thank you so much, Susan. And this concludes part 50 of our series, The 7 Medicines the Wise Woman Way, with Susan Weed at Time Monk Radio.